Hey Facebook family, I'm Dr. Janine here for your Thursday tips. I'm trying a different time, until I figure out what time is better to communicate with my followers and my peeps. So hopefully I'll see a few people join me this afternoon. I just want to touch on something that's been controversial in the news lately, and just wanted to address it really quickly. So if you're here, just let me know. Just say hi, comment, and I can communicate with you. All right? Great. All right. I'll wait to see if anyone's joining. Hi, Miss Carolyn. Thank you. Thank you so much for joining this afternoon. Hey, hi, Shad. Thank you for joining as well this afternoon. Yeah, so it's a little cloudy here today. Usually I use my lighting from my windows, but I have additional light here. So yeah. All right, so I'm just going to get started, and if you come on later, you can catch the replay. Just let me know. Just put in the comments #replay. Okay, so it's it's cloudy in Houston as well, but is it warm? Because it's very cold here. I don't think I've gone out for more than an hour in the last few days because it's cold, and I don't like the cold. Oh, okay. It's cold. Okay. Yeah, and my child is in Australia, and she calls me and complains that it's too hot. Can you believe that? So it's summertime in Australia, and she's like, Mom, it's hot and I'm sweating. I'm like, okay. Rough life there, right? Yeah. Hi, Susan. Thank you for joining this afternoon. So I'm just going to get started. Thank you all for joining this afternoon. I'm Dr. Janine. I'm your board certified family doctor and weight loss specialist and owner of Lifestyle Changes. I help women get healthy, feel better about themselves, and get their sexy back by providing a comprehensive medical weight loss program. So this is all done virtually, and it's a personalized weight loss program for you. All right, so today I'm gonna address, there was a controversy probably a few weeks ago between Lizzo and Jillian Michaels. So Jillian Michaels was the weight loss trainer on The Biggest Loser. I know everybody knows Lizzo. She's very talented musician, and she's very proud and confident about her and her body. Okay, so Jillian Michael mentioned, I'm just going to read a quote here of what she said if you didn't hear about it earlier in January. So she was on a BuzzFeed news, and this is what she said. Why are we celebrating her body? Why does it matter? Why aren't we celebrating her music? Because it isn't going to be awesome if she gets diabetes. Michael said, I'm just being honest. I love her music. My kids love her music, but there's never a moment when I'm like, I'm so glad she's overweight. Why do I even care? Why is it my job to care about her weight? Okay, so this is what she said. So she did go on to address, she's concerned, she wants her to be healthy, and yeah. So I just wanted to touch on that for a little bit and educate a little bit about weight. So a lot of people basically were upset with her because they thought she was fat shaming. Her body and everything like that. Yes, maybe she was, I'm not here to be the judge of that. But anyways, is it her place? We want to talk about what is health, okay? And can you be healthy and still have enlarged fat mass, okay? So what is health? So the World Health Organization states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. All right. So it's a state of complete physical, mental, social well-being, and not merely the absence of disease. Okay. So there's ways to being healthy, which includes like healthy eating, physical activity, your weight management, and also your stress management. So then you are fully healthy if you have complete physical, mental, and social well-being. Okay. So can you be overweight or obese and still be healthy? What do you think? All right. Anybody there? Do you think you can be obese and healthy at the same time? Okay. Yes, you can. Okay. So, yes, you can. Okay, so Susan is saying she is unhealthy. How do you know that? Okay, let me share a few things with you here. Okay, so yes, you can be obese and healthy, but for how long will that be the case? All right, so you can be metabolically healthy and excuse me, let me back up here. So in the medical world, you can call it metabolically, I can't talk today, healthy obesity. All right. So what that means is that you're healthy. You don't have like heart disease, diabetes. Your cholesterol's good. Your blood pressure's good. But you just have an increased fat mass. All right. So you usually see this in like young female. They exercise and also they eat well, like a healthy healthy foods and everything. So there's a research that also showed that in the long term, you may get these things that I just mentioned: hypertension, diabetes, cholesterol, cardiovascular disease. However, if you have good genes or you live in a wonderful lifestyle, you may not see any of these things and still be obese. Okay, so yes, you can be obese and healthy at the same time, but in the long term, you still have you should thrive to live a healthy lifestyle, so you don't get these long-term effects. All right. Let me see who said anything here. Okay. Hi, Dr. Renee. Thank you for joining. Theo, thank you for joining. Hi, Dr. Philandy. Thank you for joining this afternoon. Okay. So, can you be unhealthy and skinny? How about that? What's the answer to that question? Can you be unhealthy and skinny at the same time? So I'm just flipping it here. Anyone? Yes, absolutely. Yes. Yep, exactly. Yes, Ms. Carolyn. Yes, Dr. Renee. Yes. Okay, so you have some people that are skinny that are smokers. Okay, you have some people that are skinny and have an eating disorder. Having an eating disorder is not healthy. Okay, and you could have a skinny person that's on drugs. So that doesn't make them healthy either. So yes. So these are questions that some people ask and some people don't know the answers to. Yes, you can be obese and healthy, and yes, you can be unhealthy and skinny. All right. So anyways, what causes obesity and what is obesity? All right. Obesity is a chronic condition defined by having an excess amount of body fat. So we measure this but with a practical tool. It's called BMI. Okay. Dr. Philandi's sharing here. She said there are many unhealthy skinny people. Some skinny people may have fatty organs. Absolutely. Absolutely. And that may be due to genetics and also, not living a healthy lifestyle as well. Thank you, Dr. Philandi, for mentioning that. Yes. So anyways, obesity is a chronic condition defined by an excess amount of body fat. So we measure this by using a tool called BMI, body mass index. Anybody over the number 30 will be considered obese. All right. I'm not going to go into more of the types and also explaining more about the BMI at this time. I just wanted to kind of keep it short and interactive here. Thank you, Laura, for joining. We're talking about obesity and what it is it healthy, not healthy, and such. Also, 1/3 of adults in the U.S. are obese. All right. So what causes this obesity? Okay. Okay. And Dr. Renee is asking, does the BMI take into account your body frame? Okay. All right. So body frame meaning what? Okay. Okay, small body frame versus larger. Could that affect your BMI? So I know in regards to like the Asians versus, the Westerners, Asian body frames are smaller. And in the Western populations, we are a little bit, have a larger body frame. So yes, so BMI is tweaked for those small body frames, like such as the Asian population. Yeah, exactly. And then I was going to mention that. So muscle mass also, so like I said, BMI is just a practical tool that we use, but muscle mass does weigh more than fat mass. And yes, you can see a difference in bodybuilders with the BMI as well. Okay. Okay. Yeah, petite. Okay, got it. You're welcome, Dr. Renee. All right. So so what causes obesity? So genetics. So if you have one or both parents that are obese, you are more prone to become an obese individual. Number two, physical inactivity, because you're burning fewer calories, but you're intaking more. Number three, overeating. You're increasing your fat, increasing the carbs, and what you're intaking with your food. Also medications. Medications can cause obesity. So talk to your doctor about certain things. If you notice that your weight is going up, there may be a medication that can be contributing to this. So such as if you're on an antidepressant, some blood pressure medications, some diabetic medications can cause some weight gain as well. Steroids, it's a big culprit for weight gain, and some antihistamines as well. Also, psychological factors can cause weight gain or obesity. So some people eat due to their emotions, whether they're bored, stressed, sad, those things can also contribute to weight gain or obesity. All right. Also diseases, some chronic diseases can contribute. Hypothyroidism, PCOS or polycystic ovarian syndrome can contribute. Hi, Daddy. Thank you for joining in. We're talking a little bit about obesity today. Also, Cushing's syndrome and Prader-Willi. So some of these diseases can cause obesity. I'm not going to go into details today. I just want to, talk about some causes here. All right. Okay. So let's move on. So what can be done to prevent weight gain or obesity? Anyone out there want to share what can be done? All right, so treatment for obesity cannot be a short-term fix. So fad diets aren't going to work. Working with a nutritionist or a dietitian for a short term is not going to work. So you have to live a healthy lifestyle for the rest of your life, for a long term, for it to work. Okay, so treatment cannot be short term fix. So fad diets are not going to work. There you go, Dr. Philandy. Yes, diet and exercises, lifestyle changes. Yes, exactly. So the goal here is to achieve and maintain a healthier weight. All right. So I'm not telling you to be skinny. All right. I'm telling you to achieve and maintain a healthier weight. All right. So even with modest weight loss, you get some health benefits. So that's like between 5 to 10% of your initial weight. So 5 to 10% of your initial weight, you can decrease your blood pressure, you can decrease your cholesterol, you can also decrease your risk of diabetes. You can also decrease your, did I say increase your risk of, no, that's decrease your risk of diabetes. Sorry about that. Decrease your chance of stroke, decrease your chances of heart disease, and just decrease your overall mortality. You live longer, all right? So quick tips on how to make sure you're not gaining weight, or tips on obesity treatment. So eat healthy. Eat healthy. I know everybody hears this all the time. What is that? Eat healthy. Eat healthy whole foods. Avoid the processed junk food. So you want to increase your fiber intake. Your fruits and vegetables are important. Also, increase your physical activity. So you want to do at least 150 minutes per week of moderate intensity exercise. All right. So that's like 30 minutes in a 5-day work week. So, okay. So just 30 minutes of your time. You can even break it up, 15 minutes in the morning, 15 minutes in the evening for that. Okay. Also, I know people are not going to like me for this, but avoid alcohol. Alcohol is wasted calories. And that can also increase your weight gain, and everything. For those that cannot avoid it, make sure you drink in moderation, all right? And make sure you choose those cocktails or drinks that are lower in calories, all right? And carbohydrates as well, all right? And last but not least, I know there's more tips, but these are just a few I'm sharing. But last but not least is talk to your doctor. Talk to your doctor about these chronic diseases that cause obesity or that can increase your risk of weight gain. And also talk about the medications that you're on, all right? Once you do that, and they've done all they could, or they need the help of a weight loss specialist, hi, I'm here to help. Okay. I'm board certified in family medicine and also obesity medicine. So I can also talk to patients about their chronic disease and also medications, and to help you find a weight loss program that will work for you. All right. So yeah. Okay, Dr. Robbie's laughing at me with the alcohol probably. Okay, I had a whole Facebook Live on that before, and people were like, "Oh my gosh!" So anyways, I just wanted to toss that in there as well. Okay, so this is just a little bit about obesity. I just wanted to kind of talk a little bit about the causes, treatments, and see if anybody has questions, because I understand, I brought up the controversy, and I just wanted to kind of explain a little bit about obesity and the healthy and unhealthy, if it's healthy or unhealthy and such, okay? So does anybody else have any questions? I'm going to get out of here. I have something going on at 3. And thank you all for joining me this afternoon. I'm just trying out a few times here, and I'll be coming to you more live soon, hopefully in the next week, and I have some more updates coming. Okay, so all right, let's see here. I just want to thank everybody for coming on. All right, so again, hi, Dr. Lakeisha. Thank you, Dr. Philandy. All right, bye-bye. Okay, I'm Dr. Janine here. I'm signing off. I'm a board-certified family doctor and weight loss specialist. I help women feel better about themselves, become healthy, get their sexy back by providing a comprehensive medical weight loss program. And I'm also the owner of Lifestyle Changes, which is a virtual medical weight loss program. Well, sorry, Lifestyle Changes, which is a virtual medical practice here in Pennsylvania. All right. So thank you all again for joining me. I'll be back next week with more Thursday tips. Bye-bye.